myself, Dr. Priya Parida, consultant cardiologist, and SC Medical College, Cuttack, visiting consultant for Ashwini Hospital, CDA, Cuttack, and director of the Heart Clinic, Mahanadi Vihar, Cuttack. This is the topic of the day, latest update in hypertension. As per the WHO, nearly 63% of total deaths in India are due to non-communicable disease, of which 27% are attributed to CVD, which affects 45% of people in the 40 to 69 age group. Raised blood pressure is among the most important risk factor for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. WHO, despite that nearly half of the people, or 51% of the men and 41% of the women with hypertension, are unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living in hypertension didn't get treatment. Medication was used to control blood pressure in fewer than 1 in men, 1 in 5 men, and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal essential treatment paradigms attempts to address the issue that is in resource poor setting. Optimal care refers to evidence-based standard of care, and whereas essential standards refers to minimum standards of care to allow specification of essential standards of care for low resource settings. SCCHA has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults having no ASCVD or 10-year CVD risk less than 10% with stage 1 hypertension, blood pressure 130 to 139 and diastolic 80 to 89 millimeter mercury, management starts with non-pharmacologic therapy. If the blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. And acute respiratory distress syndrome is a potentially fatal condition involving lung damage. Experts often associate with severe COVID-19. In recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation, improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to the 110 or to less than 130 millimeter mercury range substantially reduced severe adverse events in the STEP randomized trial, aiming the sprint findings for an older Chinese population. Among 8,500 patients of age 60 to 80 in China, the intensive target trimmed 26% of the composite CV risk. Findings from a new finding from now a second major trial supporting a lower target could unite the guidelines, which even among the US professional society range from thresholds of 130 to 150 millimeter mercury. 2018 European guidelines on the management of arterial hypertension recommend that diagnosis of hypertension should not only dependent on office BP and measurements, but also and out of office measurement such as ABPM or home-based pressure monitoring. 24-hour and nighttime BP measurement were associated with greater risk of mortality and a composite CV outcome. Thus, they may be considered as the most relevant measurements for estimating CV risk. For every 20 systolic and 10 diastolic increment in BP, measuring at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. 2018 European Society of Guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, 2018 European Society guidelines recommend, especially the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination AC inhibitor or ARB plus CCB or diuretic. Since early in July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of known carcinogens, namely NDMA, which can be found in candacetan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. If 1 lakh patients would have been received a NDMA contaminated valsartan from a manufacturing unit every day for 6 years in the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. HYGEA chronotherapy trial tested whether nighttime therapy in comparison to unusual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study in individual total of 19,084 hypertensive patients. During an average follow-up of 6.3 years, 1,752 participants experienced the primary CV outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The relative reduction for CV events was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.